Welcome to this month's installment of the Medical Group Town Hall Meeting. I'm Colonel Patrick Pohle, the Medical Group Commander, and I'm joined today by Chief Master Sgt. Jeffery Vicars, Superintendent of our Operational Medical Readiness Squadron. We have a few topics we'd love to share with you today. For example, we're of course going to do our question and answer session. We're also going to give a little bit of a discussion regarding positive trends in our fight against COVID. Two of our sections that we really want to highlight today are health promotions and our pharmacy operations, and then we'll close it up a little bit, give you an idea regarding our current manning and health status for the Med Group overall. So with that, Chief, if you're ready, we'll go ahead and get started. So the first thing we'd like to start out today with is a little bit of background information regarding COVID. Obviously, we're still in the pandemic, we're still in the fight, so we wanted to give you the latest on that. You have probably noticed at this point that many of the restrictions that we've faced, both as a community and as installations, have started to ease a little bit. One of the things that we want to make clear, though, is the CDC still has recommendations regarding what's going to keep you most safe. For example, we are still emphasizing things like distancing, hand hygiene, mask wear as appropriate, and certainly if you haven't had your vaccination yet, we are still open and available to provide those. So please just reach out, contact us, and we'll get you taken care of regarding that. Now you may notice that both Chief and I are wearing masks today, even though new Secretary of Defense guidance says if you're fully vaccinated, you don't have to wear masks indoors or outdoors on DoD installations and in DoD facilities. Having said that, the Defense Health Agency has come along and briefed us that really within healthcare facilities and treatment facilities, mask wear is still a mandate. So we just wanted to make the point clear that if you come to visit us at one of our MTS locations on either the Schriever campus or our Peterson campus, then we are going to ask you to wear a mask when you enter our facility.
Sir, thanks so much for the breakdown on COVID. We also received a question regarding COVID testing. Where can people find out about it?
Well, we can go over a few options. We don't have just a single option regarding testing. So I'm going to break testing down into two categories. Are we testing somebody because they are symptomatic? For example, they've gone to see their primary care provider, there's a concern based on symptoms that it might be COVID. That's one category of testing. Then we have other categories that have to do with things like surveillance testing or testing prior to travel, whether that be leisure travel or official travel. A bunch of different reasons for testing. So let me start with symptomatic testing. In many ways, symptomatic testing is the easiest one, really, because this usually starts with a call or an appointment with one of our primary care providers. At that point, then, you will be referred to testing, and that can happen right here at our military treatment facility. Specifically on the Peterson campus is where we do the bulk of our COVID testing. So symptomatic testing, pretty easy, covered here. We also, on the installation, do testing for crews, for example, as we're doing surveillance to see what kind of prevalence we have regarding COVID, and for certain official travel obligations. The reason we get this question relatively commonly is because there are other requirements in the local community for testing as well. For example, some people need testing prior to a vacation. Some people need testing prior to returning to school, as two examples, okay? This is where it gets a little bit more difficult, and I wish I had a single phone number to offer you. That would be very helpful, but because there are several options, I want to go over some of those with you. Here's the thing to be aware of, however. Some places offer free testing, and other places offer it based on a fee or at the very least a co-payment. Okay, so most places, if you're symptomatic and you have a referral, obviously that'll be covered by either your insurance or it will simply be for free. So you have to be careful whether you're going to a private vendor of some sort, say a local pharmacy, or if you're going to something that's sponsored by the community, the state, the county, something like that. So I think the easiest thing to do for you, and we will try to post this website for you, is go to www.elpasocountyhealth.org and look up COVID-19 testing information. If it's sponsored by the community, testing is typically free. However, if you go to a testing site that, say, is tied to one of the local managed care businesses, one of the local hospital systems, something like that, then it might be free, but it might not be, and you're going to want to check regarding TRICARE benefits. In fact, on the tricare.mil website, you can search coronavirus testing and look into what your benefits actually are regarding testing versus not. Oftentimes for asymptomatic testing, in other words, like I said, if you want to go back to school, if you're going on leisure travel, oftentimes that testing won't necessarily be covered unless it's from one of these free sites, for example, associated with El Paso County.
Sir, thanks so much for that answer. We also have a couple questions regarding our lab services. The first is, I have a lab script from my downtown civilian provider. Can I visit the 21st Medical Group lab at Peterson to provide that sample?
Unfortunately, right now, based on our capacity, largely tied to COVID-19 testing, we aren't able to take scripts from downtown providers for lab testing on the installation. What we will try to do and what we continue to do is look at our resources and see when we can expand once again to be able to take those scripts. Unfortunately, for now, we would refer you back to your treating provider or a prescribing provider for the best place for you to go to get your lab test.
Thank you so much for that answer, sir. And another question came in regarding the lab as well, and it said, my PCM ordered labs in February. Can I go to the lab and have them drawn?
Unfortunately, no. There is a time limit that we set on how long you can go before you get your labs drawn, and that time limit is 60 days. If you think about why providers put in for labs, they usually want results sooner rather than later because they are trying to provide appropriate health care and timely health care. So that time limit, again, is about 60 days. So if you have a prescription for some sort of lab test and it's over 60 days, we would recommend you go back to the provider and get a new script for that lab draw. There is one exception, however. Some providers will put future labs into the system. In other words, they might say, we want to check on something regularly, so we're going to put a lab script out there for you in about 3 months. Well, in that case, of course, the 60-day limit would no longer apply because it's projected into the future. Okay, Chief, I believe that's all the questions we had for this go, but I know that we wanted to discuss a couple of our sections and information pertaining to those sections for our beneficiary population. And ladies and gentlemen, one of the things that we wanted to share with you are services presented by a section we call Health Promotions. And that section happens to fall in Chief Vicars' squadron. So Chief, if I can, let me hand it off to you to talk about Health Promotions a little bit.
Thanks so much, sir. I am very excited to get the opportunity to talk to you about our health promotions section in the Operational Medical Readiness Squadron. In my opinion, it's one of the best in the Air Force. And if you didn't know, they offer a variety of courses and classes that members can take advantage of so that they can better themselves, not only physically, but mentally as well. The first class that I wanted to highlight was our sleep hygiene program, and it's called Sleep is King. It started at the beginning of June, but it's an in-class and virtual class, so you don't have to show up every single week. All of these classes will become available by dialing 556-4292 and talking to our health promotion staff. But the sleep hygiene program is going to talk to you about the causes and consequences of sleep deprivation and how sleep is related to performance. So hopefully some folks will take advantage of that. Another class that I wanted to highlight was our nutrition and fitness challenge. It's called Thrive to Live. And it's a virtual class that begins on 1 July, and it's going to go through a series of 4 weeks where you can learn whole health strategies to help you become a better person. This class, just like the other one, can be accessed by dialing 556-4292. And did I mention that these classes are also available to all ID card holders? So even if you're not active duty, you can still take advantage of this class. The next 3 are available for active duty members only, and if you didn't hear, fitness is swinging right back into play coming 1 July. So it's important that we get back into the boot camp mindset where folks are learning how to exercise properly, There's no sign up required for this boot camp class. It's Monday through Friday. It starts at 15:30. You just show up at the lobby of the fitness center, and they're going to walk you through exercise techniques to help you become prepared for your fitness test that's beginning in July. The other class that I really am excited to highlight, this is our health promotion section in conjunction with our physical therapy section. Again, only for our active duty folks, but it's starting on the 7th of June, and it's the biomechanics of running. They'll actually analyze how you run and tell you ways to improve your strides so that it will make you a fitter, healthier runner. And the last one, sir, that I wanted to highlight is called Warrior Fit, and it's every Tuesday at 8 o'clock. There is a sign-up required for this class, but you can access it by dialing 556-4292 and just getting on the schedule. It's going to talk about training and fueling for smarter performance. So just a few of the awesome classes that our awesome health promotions team have put together to help all of our airmen become better airmen.
Thank you, Chief. And we clearly don't talk about these enough. And my desire is to continue to present these types of classes and these types of services that you all may not be aware of. Sometimes they get a little bit hidden. So thank you, Chief, for sharing that information with us today. So the last topic that we'd like to cover, at least the last main topic, is on another one of our sections to highlight, which is our pharmacy. The reason I wanted to talk a little bit about pharmacy today is I probably get more questions regarding our pharmacy services than almost any other service related to my MTF. And that makes a whole lot of sense because our pharmacy services are certainly available to the beneficiaries impaneled directly to our clinics, but they're also available to military beneficiaries in the local area. So given our location, specifically at Peterson, we are a pretty convenient, easily reachable pharmacy for most people. So we tend to get quite a bit of business. But I get a lot of questions about how we activate prescriptions, how do we get in touch with you, which pharmacy do I go to, knowing that you have several campuses. So I want to cover a few of those details. We certainly won't be able to cover all the nuances about pharmacy services, but I'll give you a website that might help a little bit more with that. But at least initially, let me give you some ideas about what we're dealing with regarding pharmacy at the Peterson Schriever Garrison. Okay, so first of all, our pharmacy is really broken up into 3 different locations. We have an in-house pharmacy at our Peterson Clinic campus. We have an in-house pharmacy at our Schriever Clinic campus, and we have what we call our satellite pharmacy, which is found in the Base Exchange. Right now, on our Peterson campus, our main pharmacy, the one that's inside the treatment facility itself, is currently closed as we are trying to change our operations a little bit. We're altering systems and workflows. So most of the pharmacy support that you'll have on the Peterson campus will actually come out of the satellite pharmacy at our Base Exchange. However, the Schriever pharmacy is still in business, still in play, and its hours of operation coincide with the clinic hours over at Schriever Air Force Base. So bear those things in mind as there are 3 possibilities when it comes to pharmacy services for the 21st Medical Group. Okay, so the first thing I want to cover, though, related to prescriptions, involves electronic prescriptions. If you have an electronic prescription from the military treatment facility or an off-base provider, please understand that that is not automatically activated. There is a process in order to get that done. And that process usually involves a phone call to 556-6200. Or you can have your prescription activated in person at the satellite pharmacy. One of the things that we're working on, however, is to use our new MHS Genesis patient portal so that our 21st Medical Group impaneled patients can go through there to activate their prescriptions before they ever show up. But that's a really important point that a lot of people don't realize. If you have an electronic prescription, it is not automatically activated. You have to take an additional step before that happens. But what about hard copy or paper prescriptions? Well, if you want those filled, you simply bring those to the satellite pharmacy. Don't mark or alter the prescriptions in any way, but bring it to them and they will step you through the process to make sure that we get those activated as well. Now, once a prescription is activated, what happens then? One of the biggest questions that we get related to the pharmacy has to do with wait times. If I activate a prescription, when can I expect it to be available? Okay, different categories of prescriptions have different wait times. If you have an urgent or emergent medication, allow at least 2 hours. And the cutoff time for same-day service is 1500. So bear that in mind. So allow for 2 hours. Cutoff date for same-day service is 1500. But what about routine or maintenance medications? Well, for those, we would ask that you allow at least 2 duty days for processing for those. There are a couple of additional aspects regarding medications that you need to be aware of as well. For example, non-formulary medications. And what that means is it's a medication that we don't typically keep within our stock in the military system. It's not on our list that we normally prescribe. In those cases, you will have to allow for 3 to 5 duty days because it will simply take a little bit longer to get that medication into our stock, fill it, and make it available to you. And also, please realize that prescription processing may be delayed if additional information is required from a prescriber's office. For example, if you have a downtown physician who prescribes you a medication and something about that prescription isn't clear, say the writing or decimal places appear to be in the wrong spot, well, all our folks, for patient safety reasons, are expected to review those things. And if it doesn't make sense, the last thing we want to do is to provide a prescription, a filled prescription to you that we're not sure is safe. So please understand that any need for clarification might actually delay your prescription a little bit further. In almost all circumstances, pharmacy staff are able to process electronic prescriptions more quickly and safely than hard copy prescriptions. So we throw that out there as a bit of a public service announcement for you. So if there's the option between electronic and hard copy, electronic is typically the way to go. And here's another piece with regard to getting your prescriptions filled. The pharmacy can typically fill up to a 90-day supply with 3 refills for most non-controlled maintenance medications if specified by your prescriber, What's nice about that is if they're able to write longer prescriptions, that's less time you have to engage in trying to get those prescriptions filled.
So that's great for new prescriptions, but what about refills?
That's a great question, Chief. So if you're already on a medication, you simply want a refill, the question comes into us, how do you get those filled and how do you request them? Well, there are a few ways to do this as well. First of all, we have an automated refill line that we call AudioCare. For all prescriptions, regardless of the date prescribed, you can dial 1-888-745-6427 or 719-524-4081. So let me give those again. 1-888-745-6427 or 719-524-4081. So that's probably the most common way that people get their refills is they simply, quote unquote, call it in, right? There's also an option within TRICARE Online. So for those of you who use TRICARE Online, you can go through there and you should be able to request a refill of your medication if one is still available on your prescription using that means as well. And those prescriptions that are available through that means are great, but for those of you that have briefed on this before, we've just moved to MHS Genesis. So TRICARE Online, it will be with us for a while, but understand that that will eventually go away. But like I said, we have time. In fact, it's available until April 2022. So if you prefer to use TRICARE Online to refill your prescriptions, as far as we know right now, that option will still be available for you a while longer. In the future, we're hoping that things like the patient portal can help us through MHS Genesis make this a little bit simpler for you. All right, the nice thing about AudioCare and TRICARE Online, they're both available 24/7, which is very helpful. And you can specify any of the Colorado Springs military treatment facility pharmacies for pickup. So if you happen to be closer to Peterson, but you get your care or your prescriber is at Fort Carson, for example, when you call in your refill, then you can actually come to Peterson to get it picked up as long as you indicate such. Now, the interesting thing about that, and the reason you're able to do that partly, is because of what we call the Joint Refill Center. The way these prescriptions actually work, or these refills actually work, is when they're called in, we have a central location within our Colorado Springs and Colorado Military Health System market where we get all of these prescriptions filled, and then those prescriptions are actually couriered to the different pharmacies in the local area. Very convenient for beneficiaries. We love that centralized processing because, again, that means you can call in a refill to any of the MTF pharmacies in the local area. But when can you request a refill? Well, let me give you some information on that as well. For non-controlled prescriptions, they can be filled once 75% of the medication has been consumed, as specified on the label directions. If the directions have changed, we recommend requesting a new prescription from the prescriber. Otherwise, that will just create confusion. As you might imagine, it may be the same medication, but if your prescriber wants to take wants you to take it more or less often, then it's probably worth a new prescription at that point. For controlled substances, for controlled prescriptions, they can be filled 2 days before the medication supply is due to run out, as specified on the label directions. So bear those aspects in mind, but in general, the refill process is really relatively easy. Now, as you might imagine, there are so many nuances and factors related to pharmacy benefits, depending on status and who you are and whether you want mail order, what do you qualify for, what's on the formulary and what's not, that there's no way we could possibly cover that in this particular video. But I am going to give you a website that might lead you down the right path. For example, some of you may wonder, if I want medications ordered to my house, can I do that, first of all? And secondly, how much would that actually cost me? This website that I'm about to give you will give you that information. So the website ties into the TRICARE pharmacy benefit, and it's actually on the tricare.mil website. And here's how it reads: www.tricare.mil, covered services, pharmacy. That's what you need to look up, and we will attach this link in the description along with this video.
Sir, are there any additional factors we need to consider when we go to the pharmacy?
Thank you, Chief. Actually, yes, there are. In fact, I'm going to go off some of the complaints and concerns that have been expressed to me regarding pharmacy ops right now. And it goes back to that idea of wait times. But now I'm not talking about how long it takes between activating a prescription and getting that prescription filled. I'm actually talking about physical presence at our pharmacies. And the main one I'm going to focus on, because it's the main one being used, is our satellite pharmacy at the Peterson Base Exchange. A lot of folks come in there and they're concerned about the wait time and why that is an issue currently. Well, there are a few things that have gone on. For one thing, we have had some manning issues. For another thing, we have switched over to the MHS Genesis system that I mentioned, and that has taken a bit for the learning curve to get through that. And then, of course, there's still the COVID pandemic. So we have to take into account how many folks we can have in a particular location, how far apart they need to be distanced, what kind of screening we have to do before we get there. But please rest assured that we do have our folks in the pharmacy working on courses of action to make the wait as short as we possibly can, to try to figure out how can we take folks that, for example, might have mobility issues or difficulty staying for certain periods of time into account and maybe move them more to the front of the line. For example, we already have set up for those members in uniform to get priority access. Well, the folks who screen when you come into our pharmacy are also going to be paying attention as best they can to mobility concerns and mobility issues in case they need to provide a little bit of additional assistance. Now, if you're wondering about when you can actually go to the pharmacy, and I'm specifically talking about the satellite pharmacy, the hours of operation are Monday through Friday, 0800 to 1600. Now, they are closed for federal holidays, for Space Operation Command family days, for training days, which are the second Thursday of each month, and as directed by the installation leadership due to inclement weather. But for the most part, that pharmacy is up and open for operations. But again, there are a few things I would ask you to consider, and I would also thank you for your patience, knowing that it is a busy place. In fact, it is a really popular pharmacy within the local area based on locations. One of the things that we like to quote around here, is, or at least understand, is that over 50% of our eligible beneficiaries live closest to Peterson Air Force Base versus the other MTFs. As you might imagine, when it comes to convenience then, our satellite pharmacy is really popular. So again, I thank you for your patience. We're working on making that situation better. So that covers the topics that we wanted to go over today. Thank you once again for joining us. And with that, Chief, would you like to offer some final thoughts?
Yes, sir, I sure would. First of all, I want to say thank you to our patients who have had the patience with us over the last year as we've battled this pandemic. I know it's not been easy, but your patience has allowed us to continue to provide the care you expect. Thanks again, and we look forward to continuing to serve you.